Good afternoon, viewer. I'm Amono Jenifer, Senior Nursing Officer from Gulu Regional Referral Hospital. Today with you here, I want to present to you how to insert postpartum intrauterine device. Thank you. A PPIUD is a method of family planning given to a mother after birth, immediately after birth from 0 to 48 hours. So it starts from antenatal, whereby we counsel pregnant mothers on the method. When a mother accepts, it is always indicated on their antenatal cards, which will be presented later when they go for delivery. So after, as you're taking up a mother's record, you also hint on the method she had accepted. So when you're inserting PPIUD, there are some items you must organize. You have to have seams forceps, which you can see it here. Then we have to have a Kelly forceps. It looks like a sponge holding, but it's longer than sponge holding. Then you must have a sponge holding for cleaning. So what we are going to do, we shall make the mother empty her bladder. Then we massage the woman's abdomen to make it contract. Then you try to expel out the clots, the remaining clots. Then clean up the mother. Then insert your seams. It should be hanging at the edge of the bed, and the mother's buttocks should be near the edge of the bed or at the edge of the bed. After inserting your seams, you now clip the anterior part of the cervix. It will use for supporting it. You clip the anterior part of the cervix. Then you load your method. But before loading, you have to check on the expiry date. You check whether there is any damage. If there's nothing, that's when now you can now load it the way I'm doing it. You get your Kelly forceps and then try to grip one of the arm, of the arm of copper T, the way I've done it. Then lift up the sponge forceps and then try to push. Okay? Then remove this. Support the fundus and then push the Kelly forceps upwards until you meet the resistance at the fundus. Then you open. After opening, you sweep it sideways and then pull it down. Then you view You view the cervix, then clean the mother. You clean her. Inwards coming outwards. Then remove the seams, remove the seams, thank the mother, and then make her dress herself and she rests. As she's resting, you give the post insertion. So for PPIUD, the strings are left long and the mother is advised to come back after 6 weeks so that it is shortened. By that week, the uterus should have gone back to its normal position and shape. So she comes and then we shorten. You have to advise her on hygiene. She has to be hygienic to prevent infection. Then you advise her to keep on checking her pads because it can be dislodged and it comes out. Why especially when this mother is still bleeding heavily. Then you advise her, also in case of any complications, she has to come back so that she's helped. So thank you, mother, for accepting this method, and I hope you'll adhere to the advice I've given you. So after, I pick my instruments and then try to put in 0.5 chlorine to decontaminate it for about 10 minutes, then remove, wash, and then dry, then recycle for the next use. Thank you. Thank you, viewers. I hope you have enjoyed. Thank you.